we've made this video for parents like ourselves who've got children with disabilities. I don't know if any of you know, but in April 2018, the statement will cease to be and will therefore be replaced by education, health and care plans.
This is the biggest change in SEND reforms that we've seen for over 25 years, and it's so important that parents and young people are involved.
It helps us plan for our children's future, and I think that's the real benefit of this new document.
It's a much wider, more holistic process. It's not just about education. It's about education, health and social care. And it's about you as parents coming together with us as professionals to produce plans that have challenging but realistic targets and outcomes for our young people.
So we'd really, encourage you to continue to watch this video and learn as much as you can so that you can help your child. So the first stage of that will be filling in the All About Me, section A. And secondly, you'll be having a transfer review meeting where the professionals will be sitting at the table or produce reports to discuss aspirations and outcomes. The school then collates all of that information and sends it through to the SEN team. So it's the SEN team's responsibility to draft that plan. And then after that point, they will send it to you to review and make sure that you're happy with it. If your child's going to a secondary school or a new college, they will forward that on to that new college to check and consult with that college to say, can that college meet their needs? And then hopefully that's okay, the plan is finalised.
We attended the training that was provided by the London Borough of Enfield, and it was great, it was fantastic. It gave me a really good insight as to what to expect, what reports I'd need to have, the things that I'd need to take into consideration, and then most importantly, what I could do to prepare Brandon.
I attended with my primary school Senko, like Natalie did, and
yeah.
that worked really, really well because then we both knew what to expect at that transfer meeting and what role each of us was going to be taking within that setting.
It's also really, really useful if you make sure that all your reports are up to date, your EP, your speech and language therapist and any other professionals that are involved in your child's care. Just make sure that all the reports are up to date and they include all the things you think that are relevant and important to your child.
We asked for reports from all of the professionals and I wanted to see those before the meeting and have time to review them before, so that was quite important. If you go onto the local offer, it will tell you the dates in which your child is going to be transferring and the dates in which the meetings, at the time frame in which the meetings are going to occur, so you've got a heads up, so you know beforehand, rather than sitting and waiting for a letter to come through the post, you have an idea of how long you've got to prepare. So I think that's quite important.
When I started, it was daunting, but when I was almost halfway through, it wasn't. The process was a lot more clearer. We had actually used the Send IS department to help us through it.
We break it down for parents and explain how they can show what their child's strengths are, focusing on the positive, on the aspirations of the child and the aspirations of the family for that child. And then we will give prompts and different communication techniques which can be used to get the child's views regardless of their needs.
I'm just looking on myself.
And that's something you've just learnt to do?
Yeah.
Wow.
Yeah.
How did that make you feel?
Good.
Yeah.
Decision.
It was a good decision.
Find a way that they can communicate what they want to the outside world in the most effective way and be able to express what they need. And that has to start quite early.
One parent said that they had paints. So they got a set of paints and said, oh, can you paint me when you feel happy? Paint me a picture of when you're happy. And I think their child painted a sun. And that was just it. It was just a sun. She said, I'm presuming it's summertime. He feels happiest in the summertime or when he's outside.
Because Maria isn't verbal and she uses a communication aid, I had to really think actually about how I was going to get her views. So One of the things that I did was video her, actually. So I would ask her a question about the kind of things that she likes and what she'd like to do as she gets older, and then I would give her the time to respond using her communication aid. And then once she had her answer, I would then video her telling me through the aid.
I suppose it's actually thinking about the whole personality of the child, so not just their disability. It's also focusing on all the positives, all the things that they do like doing, socializing, out of school activities, after school clubs, even during weekends.
I think it's just really sort of trying to think about different things, ways that might draw your child out, because not every child is the same. You really have to think out of the box on this one.
I like Thomas and I like trains, and the best of all, I like playing my Xbox.
From my perspective as a school, I think what Sam needs is he really needs to have a buddy, and that will help him to get into more of his lessons. What do you think, Mum?
Yeah, no, I think that would really help actually, because he's saying he wants to have friends and he hasn't got any friends, that to me is like one of the hardest things.
What do you think, Sam? How would you feel about having a buddy?
I would love it. That would be really good.
Yeah.
And it would allow me to have more friends.
Excellent. Have you got anybody in mind that you quite like hanging around with, that perhaps could escort you to some of the lessons you're finding a little bit hard?
Jimmy.
Jimmy,
Yes.
Okay, he's a nice guy, Jimmy. I think that will be absolutely fine.
Okay, so one of Maria's aspirations is that she would like to become a chef. So we really thought about that when we went into the transfer review meeting and what that would mean for the outcomes that she has. What really is most important for her is to be able to communicate that using her aid, so to be able to direct somebody else to do some of that work for her because she's not physically able to do that. So all of the therapy is really important to reach that outcome for her and that aspiration, but they all need to work together and understand how they all fit into that puzzle. And it was what was really useful and I found really productive about the transfer meeting was that we could have that discussion around the table. And we could all agree.
At the actual meeting itself, all the professionals were there, and then Brandon was brought in with his TA. I'd say he was a little bit overwhelmed, but then it's something new, and him being on the autistic spectrum, I think that might have been the situation. It was a new experience. It was new for all of us. In terms of what we got out of the meeting, it all went really well. I felt that everybody listened and respected everybody else's views. And what we ended up with was something that best reflected who Brandon was.
It doesn't only focus on what they can't do, but also looks at what motivates them, what they enjoy doing, what they like, and what they can do. So it's a far more balanced perspective of that young person.
The benefits have been tremendous. It's actually made us focus on our child, and it's actually made us think that we actually do need to take her views into account, because even though she can't communicate, it's equally important that she has got a choice in a lot of things as well, school and at home.
It makes the parent feel valued and that actually they have a contribution to make in terms of their child's outcomes and their development. At the end of the day, parents spend the majority of the time with their young people, so why wouldn't we ask them? Why wouldn't we involve them? It just makes sense.
Once we got a final draft of our plan, for us it was very robust and really reflected that conversation, reflected all of the work that we'd done in the months leading up to it, reflected what Maria wanted and was important for her. And when I took it to her new school, they could see exactly where we wanted to go.
It actually is very important for secondary school, because you can't say everything about your child to every teacher or every TA, but they can look at the All About Me section and think actually we do know, partly what she's like, so yeah.
Because you've got the buy-in of everybody because they're all at the meeting, you're less likely to then come across lots of challenges later on where provision or things are not put into the plan because you haven't had a chance to discuss them at that meeting.
Under the old statement of special educational needs, it was very much, I felt, the voice of professionals, the voice of the school that rang true and loud. And now I think this is a wonderful opportunity for the pupils themselves to talk about how their needs affect them, what they want, what their ambitions are.
At the beginning, yes, my son's 6 years old now, non-verbal. There will be a lot of what I'm putting into it. As the years go by, I hope he begins to become more, he comes more to the front, and it gets to the point where he's taking over more and more. And then as we come towards him becoming a young adult, he will have practiced for many years how to speak for himself.
We want to work with parents. We need you. We need you to be involved strategically, helping us make plans and produce better services in Enfield, but most of all, we need you as mum and dad to be involved in the lives of your children. So come on, don't be frightened, don't be ostriches, don't put your heads in the sand, come and help us. We need you to get this right.
It is an opportunity to kind of work with all the professionals to make sure that your child's getting the best out of their lives.
Don't panic. It's not something that you really need to be petrified about, you just need to be informed. And if you go to training and you read all the literature that's available to you, then there shouldn't be a reason to panic. It's beneficial for your child, it's all for the benefit of your child and their future.